And I would like to welcome our guest at this time, Dani Cook, a healthcare advocate, also a part of Citizens Advocacy Ballad Health, which is a Facebook page and has significantly grown in recent months. Dani, good morning.
Good morning. Thank you for having me.
Can you please tell me what has you so motivated about the changes Ballad Health is looking to make or is making here in the Tri-Cities?
For me, it's real simple. In August 2017, my granddaughter was born at Holston Valley Medical Center unexpectedly at 26 weeks, and she weighed just 1 pound 3 ounces at birth. She spent 91 days in the NICU, and if you've never experienced it, it's like nothing you can describe. You begin to rely on people to do things for your family and for your baby or your grandbaby that you would normally do, and you develop relationships that make them like family. And I owe them pretty much everything. Without that hospital, without those physicians, those nurses, I might not have my grandbaby or my daughter. So when I heard that the plan was to get rid of this NICU that I know services approximately 300 babies and that so many people in this area rely on its services, I asked myself, what can I do? And the answer for me is anything possible. So if I can use Facebook, if I can use social media, if I can get people informed and we can protect healthcare for what started out as just the NICU babies, but turns out to be 1.2 million people in this region, then I want to do that. And I want to do that with everything in me.
Obviously, this is personal for you.
Yes.
And rightly so. Now, Mountain States Health Alliance and Wellmont merged. Ballad Health was created. The Certificate of Public Advantage, the COPA, exists. Mm-hmm. And I've also read a document, I believe it was from the Virginia Department of Health. It's been a while since I've looked through those papers, Dani, but I remember seeing language in there that was talking, I believe the Virginia letter was saying how much of a challenge it would be if Holston Valley Medical Center lost its level 1 trauma status. Mm-hmm. And that language was already of concern in
Correct.
That particular letter. And again, I think that was from the Virginia Department of Health. I wish I had that folder today. But that plus this all being known, in other words, this was the plan. Was
Correct.
It not?
Yeah, this was the plan. They, regardless of what people think, this was 100% absolutely the plan. If you go back and you watch the public hearings, there's actually some discussion around losing the level 1 trauma center at Holston Valley. If you look at the bond, the SEC bond paperwork that Ballad Health filed when they got the bond out of Greenville last April and May, it actually says downgrading and eliminating and consolidating the NICU and PED services at Holston Valley as well as the level 1 trauma center.
I've made it very clear myself on this very program in recent months that as a paramedic, it bothers me that the assumption is, or appears to be, that Southwest Virginia and Hawkins County, Tennessee are going to have adequate personnel to make the longer trips to Johnson City, or they're just going to happen to have perfect weather and plenty of helicopters available for the transports, and I guess everybody's going to be able to pay for it.
Right.
That's personally bothered me, Dani.
Right.
So what is the group doing in terms of advocacy? What's the strategy?
So, we've had to be very fluid in our strategy. So in the beginning, I was very hopeful. In the beginning, my thought process was, well, maybe the Tennessee Department of Health and the Virginia Department of Health do not know. Maybe they're not aware of everything that's happening, what the patients and families are experiencing here. And so my goal was to dig and get as much information to them and show what I consider to be violations of the terms of certification. To me, the language saying if there's a public disadvantage that's outweighed by the lack of competition is pretty clear, and it shouldn't take, a vast amount, and it definitely shouldn't take, lives being endangered or lost for our states and the Commonwealth to say, hey, maybe we need to reassess this thing. So it started out with getting information to the Tennessee Department of Health, Virginia Department of Health, the attorneys generals. It started out with letters and emails and phone calls to our state legislators and our senators. And then it was to mobilize a group of people and get them to show up at that local COPA hearing. So my belief was that if we had people come out and speak and share, employees, doctors, physicians, patients, nurses, and share what their experience is, then surely they would have a responsibility to the people to listen. And it didn't happen. So now my strategy is I want to get as much attention on what's happened here as possible, locally, statewide, nationwide, so that people can begin to examine what's happened. Because the goal, I don't know if everybody's aware, the goal is to take what Ballad Health has done in this community and be able to roll that out in different areas in rural America across the country. And that's very dangerous. That's very concerning. So the FTC is going to have a hearing specifically on COPAs, and it's called, Health Check on COPAs, and that's June 18th. So our goal between now and then is to get as many signatures on our petition as we can. Right now we have approximately 15 to 20 local citizens that are going to DC, and we're going to be mobilizing and sharing and giving feedback on these 7 specific questions that the FTC has, because even though the merger has quote unquote happened, the majority of their assets are still separate and have to remain that way, which means we have some time, however a little bit of time that is, to go as hard as we can, hard in the paint, to get some changes and some potential different solutions around what's happening here.
Dani, to the people in Northeast Tennessee and Southwest Virginia, what are the most significant changes Ballad Health is looking to make?
Obviously, the downgrading of the Holston Valley Trauma Center from a level 1 to a level 3 is huge. Virginia does not recognize level 3 trauma centers for transport and for treatment. So that's significant. That means you're not going to Holston Valley. You're going to go to Johnson City. If you have a wreck in Yuma, like I know an EMS person whose daughter just did, where she absolutely needed level 1 trauma care and was right across the state line, she's not going to be able to go to Holston Valley like she did this time and get neurological treatment and orthopedic treatment and radiology treatment. That's not going to be available to her. She's going to be flown all the way to Johnson City, assuming that the weather's great and that's possible. So that's significant. We're going to go from 28 specialties that are on call or in the hospital 24/7. And we need to be clear. These specialists don't just treat traumas. It's not like the neuro guy sits back and say, hey, I'm only going to do neuro work on a trauma patient. That's not what happens. The Tennessee Health Department does an annual trauma care plan, a report. And one of the things that they stipulate is that having a level 1 trauma increases the quality of care that you get throughout your entire hospital. I mean, it just raises the bar in terms of the type of care that you get in all capacities. So going from that level 1 to a level 3 that only has 4 specialties, that being like internal medicine and general surgery, that does not include neurology, does not include orthopedics, does not include radiology, is going to be significant, because Southwest Virginia has no trauma center, as we know, and many of the places don't even have an emergency room or a hospital to speak of. So that is number 1, which will be significant. The second would be the closing of the Holston Valley NICU. That level 3 NICU services approximately 300 babies. And what Ballad Health will tell you is that, we're only talking about the very low birth weight babies that are born weighing less than 1,500 grams, which is 3.3 pounds. It's not true. We had about 83 babies that were treated with NAS, which is neonatal abstinence syndrome, drug-exposed babies, last year. Southwest Virginia's NAS baby rates has increased by 31% over the last couple of years, and it's significant. Our infant mortality rates in Northeast Tennessee and Southwest Virginia are 2 and 3 times the national average. Our babies die more than the rest of the country in rural America, and specifically here. We have an opioid problem here. All of those things are going to impact the lives and well-being of our people. And you're right. I worry about paramedics. I worry about their hearts and their emotional well-being when they can't get someone to care in 20 minutes, when they know they want to be doing better than they can. It's happening to nurses right now. It's happening to doctors right now, where they want to be giving better care than they are able to. And I worry about the impact that that's going to have on our EMS folks, our medical personnel, as well as our families throughout the entire region.
No doubt a lot of people interested in what is or is not happening in terms of the upcoming changes with Ballad Health. We're going to continue the conversation ahead with Dani Cook of the Citizens Advocacy Group. You can find the group on Facebook, Citizens Advocacy Ballad Health. It's 831 Super Talk 92.9. Super Talk 92.9. Scotty Campbell with you. Good morning, here where we talk local, state, and national issues. Also Facebook, Super Talk Morning Show. Quick check of your weather today. Partly sunny, 81, 30% chance of storms. Tonight, mostly clear, 53. Tomorrow, sunshine and 80. Right now, 67 at 8:37, and it is once again time for you to win. What is it this time, you say? It's 2 tickets to the Richard Lee Songwriters Festival at the Higher Ed Center in Abingdon at Virginia Highlands Community College campus, Saturday night, May 25th. And caller 7 this time around wins at 800-469-0098. Plus, I'm supposed to talk with Richard Lee, who originally was from this region. We'll be catching up with him sometime on the show tomorrow morning. I'm joined live in studio right now by Dani Cook, who is a healthcare advocate and shared her personal story regarding the NICU at Holston Valley Medical Center in Kingsport. Okay, we've talked a lot over the past few minutes about the build-up, the lead-up to where things are today. What do you need most from the public, Dani?
Awareness and involvement. There is this misconception that, oh, it's a done deal, or isn't it too late, or maybe we should have done this before. We need signatures on those petitions. We need the public sharing their story. And we need folks that are joining into, we have a very peaceful protest. This is day 19, where we are out there 24/7 collecting signatures on these petitions, getting information out to folks. We need the public to speak up and to be involved in the process, to be contacting their legislators, their health departments, and their attorneys general. All of those things are important, because if we lose these services, we will not get them back. And then the other thing that I need for the public to do is vote. If you are in Kingsport, Bristol, and Bluff City, tomorrow is the election. It is imperative that we pick leadership that we know is going to fight for our health care, because whether you want to tie the two together or not, our healthcare system is the largest employer in this region. Healthcare is the reason businesses come to locations. Healthcare is a driving force for real estate. So if you want to talk economic development, if you want to talk about the well-being of our communities, healthcare is essential to that process. So, make sure that the folks that you're voting for, number one, that you do vote tomorrow, and then make sure that the folks that you're voting for are going to fight for your right to access to quality healthcare.
Okay. Now, I have pretty strong feelings on this, but in an effort to be fair, I'm going to ask this question.
Sure.
Memphis has one level 1 trauma center. Mm-hmm. Nashville has one. Chattanooga has one. Tri-Cities has 2. Why and why not?
Well, I think, number one, you have to think about a couple of different things. The geography for Memphis and Nashville is significantly different than our region. They are also supported. So one of the arguments that Ballad has used that I think they forget works both ways is volume. So if I'm in Memphis, and let's just say I have one level 1 trauma, but I also have a level 2, and then I have 2 or 3 level 3s, those places get volume that allows them to handle higher level traumas more easily and more competently than, say, a rural community like ours would. The other thing is the state of Tennessee believes that we needed one, or they wouldn't have been granted a certificate of need to get one. So it's understanding that we are different in terms of our geography, in terms of our travel times, and the types of injuries that we have. So just because somebody else doesn't have one doesn't mean we should give ours up. You know what I mean? I don't understand that, and being able to say, hey, we are blessed to have 2 systems, and because no one else does, we should give ours up. No, we should fight to protect what we have because we need it. It would be different if these services weren't being utilized, but they absolutely are.
I'm surprised Southwest Virginia hasn't put more of a voice and a fight up about this, because in my eyes, as a person who has transported patients on many occasions, Holston Valley Medical Center, in my brain, is Southwest Virginia's trauma center, even though it's in Tennessee.
It is. It absolutely is. I've talked to some of the EMS folks from Southwest Virginia, and being out there for the last 19 days, we see Duffield, we see Scott County, we see Lee County on a regular basis. It's not a, once every few days. No, it's every single day, several times a day. I think that part of the reason people aren't speaking out as loudly in Southwest Virginia is A, lack of information and lack of knowledge, B, misinformation by the media because they've given the idea that somehow this is a done deal and there's no need to fight, and 3, they just believed what their politicians have told them.
Well, and almost all I heard and I wasn't hosting the show yet, but almost all I heard, and I was moving back from Nashville actually, but I kept hearing these headlines about how Wellmont and Mountain States are merging, but they're not going to close any hospitals. That's what I kept hearing.
Right.
That was the headline that grabbed my eye multiple times. Oh, okay. I wasn't paying attention to it. I'll just tell you the fact. But now that I'm up here, it's like, wait a second. No, I wasn't reading the COPA either. But guess what? I wasn't in the state legislature. And plus, frankly, I didn't know I was going to be back home. But here we are.
Right.
And now it's like, wait a minute. What are y'all trying to do? And the state approved this? And they did.
They did.
And that's what I want the audience to absolutely know, Dani. This is not an 11th hour surprise by Ballad Health.
No.
It just sounds like it because you didn't know.
Correct. And that's why, so when people say, I've just come and riled people up, no, all I did was shine a light on what's been happening for the last 4 and 5 years, and let people know, hey, this has been in the works. And that's what got people angry, was because they trusted the people that they elected, and they trusted the state of Tennessee and the Commonwealth of Virginia, only to find out, hey, you all are making decisions that are not in our best interest. And so the public is upset because they feel like they've been deceived and taken advantage of for this whole entire time. And that's part of the problem. So you're right. No, this is something that's been in the works, been in the plans, and well thought out for a long time. And you can tell that by the types of laws that were passed. They didn't just pass an amendment. So what the public needs to understand is the COPA is not new. There was a law called the Hospital Cooperation Act of 1993. That law alone would have allowed Mountain States Health Alliance and Wellmont Health Systems to work together. They could have shared patients, equipment, physician referrals. They could have done what was necessary to cooperate together to provide quality health care to the people in this region and still remain profitable, right? But that wasn't enough. They wanted to be able to merge. They wanted to get antitrust immunity. And then they wanted it badly enough that they had your legislators actually write into the law that if you want to challenge that COPA law, you have to put up a bond that is big enough to cover the financial loss of the hospital system, and you have to pay their attorney's fees. That's insane. That tells you automatically that they knew what they were doing wasn't right, and that if people figured it out, they were going to want to do something about it. And when we talk about profit, they want to talk about Holston Valley Medical Center had an aggregate profit loss of $41 million between 2015 and 2017. Well, Holston Valley is one part of a much larger health system, right? That has outpatient surgery centers and outpatient facilities, rehab facilities, and hospice and home health care. And Wellmont Health System had an aggregate profit of $150 million between 2015 and 2017. So I would assume, even with Holston Valley's loss, right, they were still able to be very profitable. So the idea that they needed to do this to survive is just simply not accurate.
I want to be very clear. You are not with Ballad Health, but
Correct.
I'm going to ask you, since you're here, how's the financial picture of Ballad Health today?
Oh, their financial picture is well, it depends on what you believe, but it's doing very well for what they want it to. They are great at spinning the data and spinning the numbers. And there's a little bit of what I call, this is just my personal opinion, a little bit of robbing Peter to pay Paul, and, moving things around to make them look certain ways. And that's something that you can do when you have a $3 billion healthcare system. Just think about this. They just put out in a press release that they had a profit of $66 million for this fiscal quarter, right? Well, the NICU, to run that NICU as either a level 1 well baby nursery or a level 3 NICU, which it is right now, the difference is $1 million. It's $500,000 a year to run it as a well baby nursery, which is what they want to downgrade it to. And it's $1.5 million to run it as a level 3 state-of-the-art facility that it is currently. So if you're a healthcare organization that is truly interested in the well-being of the community, and it's only going to cost you $1 million a year and you just put $66 million in the bank, why would you touch the lives of babies for $10 million? The answer is you wouldn't, unless by downgrading that level 3 NICU and downgrading that level 1 trauma center makes Johnson City Medical Center and Niswonger Children's Hospital a safety net designation hospital, which gets them $15 million in funding every year for the next 10 years. That's why you would do it, and that's why they're doing it.
Dani Cook, thank you kindly.
You're very welcome.
Facebook, search for Citizens Advocacy Ballad Health. It is 847 SuperTalk 92.9. SuperTalk 92.9. It is your turn, actually. Call me, 800-469-0098. Dani Cook's going to hang out in the hot seat here. So whether it's about the situation with Ballad or anything else, we'll talk about it. That's what I do. Jeff in Telford's up next. Good morning, Jeff.
Hi, good morning. I wanted to thank Ms. Cook for her time, and the information on Ballad that she provided was great. I think she's doing a terrific job, and I'd like to suggest to her that Mr. Levine's salary and benefit package might be a good indicator for their financial status if she wants to.
Yeah, I would agree with you on that. We know before the merger he was pulling in about $1.4 million, and if that's with one health system, I would reckon he's not doing two health systems for less than that.
$1.4 million, was that a 5-year contract or something?
Oh no, sweetie,
a couple
that was
$100,000 a year.
Just one. Yeah, we could have run that whole NICU off of his salary alone. I mean, if I were Alan, and I'm not, but if I were and I had a $1.5 million and I could save some babies' lives, I might be interested in taking a pay cut. But that's just me.
Well, hopefully Rusty Crowe is listening this morning. And
well, Rusty's not too fond of me, Jeff. He might have turned it off by now if he is. But that's because he's got about 70-plus sworn complaints down there at the Senate Ethics Committee asking about the laws that he passed on behalf of his employer. So,
right. Right. So anyway, I don't know if do we want to keep on with this, or can I go into what I had called about?
Go right into it, wide open.
Okay, this is for Worm. Worm, have you heard about the recent survey by Civic Science that asked Americans if we should teach Arabic numerals in the public schools?
Worm has left the building, but I saw the headline you're speaking of. I did see a headline last night. Yeah.
Well, here's what it said. It said that 3,624 people were polled, and that 56% said that Arabic numerals should not be taught, and 15% had no opinion. So that indicates that 71% of those polled are morons, and I suspect that most of them are allowed to vote in elections. And that goes back to that point I was trying to make a few days ago about, letting stupid people vote is, as they become more prevalent, our votes are diluted.
Jeff, I intend to spend a lot of time on your topic of who can vote, who should be able to vote, and I want you to be a part of that when we do that conversation, because I assure you it is in the box of things to come.
Well, hey, before I go, I've got another lead-in song for you, but I wanted to make a suggestion for Sullivan County's sheriff. You know now that they're in financial difficulty, right?
Yes.
Well, this suggestion makes about as much sense as his promise not to sue the county for funding, but here it is. Put half of the prisoners on parole and send them to Virginia, sort of like the Unicoi County did with the Appalachian Trail killer.
Jeff has spoken.
Hey, here's your song.
I love it. Thank you. Bye, Jeff. And thank you, Blondie, ladies and gentlemen. That's who that was, right? I think so. The song.
Yeah.
Okay, next. See, Dani, I talk to anybody about anything.
I love it.
There is structure, but within that structure, there's freedom on this show, and that includes freedom of speech. So here we go. Next up, ladies and gentlemen, Curtis from Boones Creek. Good morning, Curtis.
Good morning, Scotty. Good morning, all. How you doing?
Doing well. How about you?
Doing well. What we got tomorrow?
I see on my calendar Curtis from Boones Creek live in studio to talk local, state, and national issues and to ask the big question.
I would love to talk with Tim in Bristol about some biblical morality. He brought that up, and I'm just not quite convinced that he truly understands it. So that could be one topic on the table, especially for Tim.
Okay. And, we'll talk a lot of different things, too.
Sorry, Chris. He's the one that called in earlier talking about Buttigieg, right?
Right. Yeah, Chris was.
Yeah.
But you do have questions
Awesome.
for Tim too, right?
Yeah, we can pick a few points with him as well.
Okay. What time are you going to be here in the morning, Curtis?
I'll be here bright and early.
Okay. 7:05.
Yes, can't wait.
Curtis, have a great day.
You too, Scotty.
Dani?
Yes.
Curtis is an atheist and brings a different perspective to this variety-filled show. And some people say I shouldn't ever allow him on here, and others say I commend what you're doing. There's a plan, and that's all I have to say about that. Tim in Bristol. Hello, Tim.
Well, I was kind of hesitant coming on after Curtis, but since I know he's going to be on tomorrow morning on Tuesday, that's great. Well, anyhow, let's deal with facts. Can you please forward that email, that 5-page email I sent you about the abortion breast cancer link to Curtis?
I can try to get his email address tomorrow. Yeah.
Okay, well, or just hand it to him, whatever. But anyhow, the abortion breast cancer length is relevant and brought out in 73% of the health studies that are out there. That is a fact that Curtis cannot deny. And please don't let him change the subject, because that's what he does. He did that the last time. Anyhow, what it does is it leaves the Abortion Act leaves an excess amount of estrogen and other hormones that are developing these breast cells, and they can go radical later on because it hasn't finished the process and they're not fully matured. That's what happens. Anytime that a woman takes estrogen therapy for menopause or whatever, doctors are required to give a estrogen warning. It's required by the FDA. But why isn't it for this medical procedure?
Some things make me wonder.
Yeah.
Hey, Tim, is it true?
Anyhow,
Is it true you wanted to talk about armadillos?
Armadillo, well, now that was Saturday, and that was with Rick, and he added leprosy and rubbing stuff on people's faces that I did not even mention. I said it's dillo dirt, and I'll tell George about it. It's in the compost. And he added all this stuff to it that I did not say. Liberals have the audacity to change someone's verbiage when it suits them.
Ain't that the
truth? And I'm not sure what he was trying to do with that, but, you know, he needs to be held accountable. So, dock his paycheck a little bit. If
First
he
of
can't
all,
be truthful.
First
Not
of all,
now.
bye, Tim. First of all, I have nothing to do with the man's paycheck. I just work here, and so does Rick. And I can assure you, if I received his resume, it would be in the file 13, or appropriately filed in accordance with law, or whatever the case is. But
I stand by everything I heard.
I bet you do.
By everything.
My screen says armadillo feces facials. That's what it says, and I know who put it there. Back tomorrow, 7 a.m. until 9, I think.